Good day, everyone. My name is Christine Yalan Sumawang, a student nurse from Tarlac State University from BSN 1B. And for today, I will be performing donning and removing of sterile gloves in an open method. So first thing that we need to do is we need to know the purposes of this procedure. So the first purpose is to enable us to handle or to touch sterile objects freely without contaminating them. Next is to prevent transmission of potentially infected organisms from the nurse's hand to clients at high risk for infections. So following the nursing process, we will now proceed to the assessment phase. First thing that we need to do is we need to review the client's record and order to determine exactly what procedure will be performed that requires sterile gloves. Next is to check the client's record and ask about latex allergies. We need to use non-latex gloves whenever possible. And now we will proceed to our planning phase. So the first thing that we need to do is we need to think through the procedure and plan which step is needed to be completed before applying gloves. Next is we need to determine some additional supplies for the procedure. Also, we do need to have an extra extra pair of gloves if available. So as you can see here, we have two gloves. And now we will proceed to the assembling of our equipments. We do need to have a package of sterile gloves. So now we will proceed to our implementation phase. So the first thing that we need to do is we need to determine the correct size of the sterile gloves. The glove should be snug but not too tight. So as you can see here, the gloves that I have has a size of 7.5, and also we need to ensure the sterility of the sterile gloves. So to know the sterility, we need to check or to look for the expiration date of the package. So my package expiration date is on the month of July, year of 2025. So now we will be proceeding to our performance. So the first thing that we need to do prior to the performing procedure, we need to introduce ourselves to the patient and verify the patient's identity. And also we need to explain to the patient what we are going to do and why is it necessary. And we need to assess whether the patient has the ability to assist or to cooperate with our procedure. So here's an example. So good day, ma'am. My name is Chris, a student nurse from Tarlac State University. And today I will be performing the donning and the removing of sterile gloves in an open method. So the purpose, or it is very necessary to prevent the transmission of potentially infected organisms from the nurse's hand to clients that has a high risk for infection. So for our next step, we need to open the outer wrapper and place the inner glove package on a clean, dry surface. And for our next step, we need to open the inner glove package and so that the glove cuff is closer to you, and we need to carefully open the flap of the package so that they do not fold back over and contaminate the gloves. And for our next step, we need to slide our we need to put our first glove in our dominant hand. And to do that, we will need to grasp the inner surface of the glove for our dominant hand, lifting the folded cuff edge of the glove for our using our thumb and our first finger of the non-dominant hand. Next is we need to slide our dominant hand into the gloves. We need to keep our hands and our fingers above waist level and away from the body. For our next step, we need to put on our second glove to our non-dominant hand. And to do that, we will need to pick up the other glove using our sterile glove hand, and we need to insert our fingers under the cuff of the glove. Next step is we need to lift our glove up away from the table and away from the body. And after that, we need to slide our non-dominant hand to the into the gloves, and we need to be careful to avoid contact with the other gloved hand. For our next step, we need to adjust both our gloves to fit in our hands. If necessary, we need to pull the fingers of the gloves down so no excess is at the fingertips. For our next step, we need to place our hand in between our shoulders with our hands at the waist level in front of us. So for our next step, we need to remove and dispose of the gloves, and we need to remember that there is no special technique in removing the gloves. If it is soiled in secretion, we need to remove the gloves by turning it inside out, and after that we will be performing hand hygiene. For our next step, we need to document that sterile technique was used in this performance for the procedure. And for our evaluation, We need to conduct any follow-ups indicated during the care of our client, and we need to ensure that adequate number and type of sterile supplies are available for the next healthcare provider. And that would be all for the performance or performing of the donning and removing of the sterile gloves. Thank you.